Hospitals successfully performs its first kidney transplant after receiving official transplant license. Cytecare Hospitals proudly announces a major clinical milestone with the success of completion of their first kidney transplant surgery. After receiving the official kidney transplant license, the patient has recovered well and has been discharged in stable condition, marking a significant achievement in Cytecare's journey towards comprehensive, advanced, and tertiary care. The transplant was performed by the multidisciplinary team comprising experts from nephrology, urology, anaesthesia, transplant surgery, critical care, and transplant nursing. The accomplishment highlights Cytecare's readiness and commitment to providing safe, ethical, and world class organ transplant services in Karnataka. Mr. Jojis Mathew, the center head, Cytecare Hospital.
Now, Cytecare Hospitals, I extend a warm welcome to all of you present here from media, our team members, clinical expertise, and the guests who have joined. As we all know, we are here to celebrate a major milestone in the healthcare industry. We have recently received our kidney transplant license, and now we have successfully completed the first transplant case. So we are proud of our leadership team led by Mr. Jojis Mathew and dedicated expert from our nephrology and transplant team, Dr. Krithika from nephrology team, Dr. Ashwin will be joining in some time. He is from the transplant team, along with the specialists, other surgical nurses, ICU staff, coordinators, and everybody who is involved for this successful story.
To all our the press who have come here, I would like to welcome all of you as part of the Cytecare Hospitals. I would like to tell that it gives me immense pleasure and pride to stand before you as Cytecare Hospital celebrates a significant milestone which is already told, our first successful transplant. This achievement completed shortly after we received the official transplant license. We received the license in October. So soon after that we have started the transplant, and this reflects the trust placed in our hospital and expertise of our clinical team. Our dialysis and nephrology center was launched in 2023 in August, 15th August 2023, with a strong belief in providing patients with state-of-the-art facilities and high standard of care. Over the time, the center has grown into a robust, multidisciplinary unit capable of delivering comprehensive renal services. So today's milestone demonstrates Cytecare's commitment to expanding our capability beyond oncology and strengthening our position as a comprehensive, advanced care medical institution. I would like to tell that we are in the process of developing. Cytecare was essentially an oncology-focused hospital. Now the plan is to actually sort of develop other specialties and move to a more super specialty hospital. We are planning to diversify or build cardiology, cardiac services, then neuro, then your gastro, and few other ortho and hospital. And that's what our plan is in the next 2 to 3 years. So to continue the same, our nephrology and kidney care is equipped with dedicated transplant, that's an operating theatre, a specialized transplant ICU, modern dialysis facilities, and round the clock. The most important thing is multidisciplinary support. But the real strength is our team, led by Dr. Krithika, Dr. Ashwin. Then we have a team of another surgeons, anesthetists, intensivists, nurses, transplant coordinator, who works because it's a teamwork. Essentially, in a transplant, it's a teamwork. Starting from all the approvals to the clinical, to the nursing, to the coordination, everything is a teamwork. So, to expand the transplant program, we are also looking at cadaver in the near future, and to strengthen our dialysis services, and to build Cytecare into a super specialty hospital sought after by the patients for the services in the North Bangalore. So with this, I sort of
ಕಳೆದ 1.5 ವರ್ಷದಿಂದ ನನ್ನ ತಮ್ಮನಿಗೆ ಕಿಡ್ನಿ ಡ್ಯಾಮೇಜ್ ಆಗಿತ್ತು. ಕಿಡ್ನಿ ಡ್ಯಾಮೇಜ್ ಆಗಿರೋದ್ರಿಂದ ಡಯಾಲಿಸಿಸ್ ಅಲ್ಲಿ ಇರಬೇಕು, ಇಲ್ಲ ಲೈಫ್ ಲಾಂಗ್ ಡಯಾಲಿಸಿಸ್ 2 ಆಪ್ಷನ್ ಇರುತ್ತೆ. ಒಂದು ಬಂದು ಡಯಾಲಿಸಿಸ್ ಅಲ್ಲಿ ಇರಬೇಕು ಲೈಫ್ ಲಾಂಗ್, ಇನ್ನೊಂದು ಬಂದು ಕಿಡ್ನಿ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡಿದ್ರೆ ಅವ್ನ ಲೈಫ್ ಚೆನ್ನಾಗಾಗುತ್ತೆ. ಮತ್ತೆ ಅವ್ನಿಗೆ ಯಾವುದೇ ತರದ ಕೆಲಸ ಮಾಡಕ್ ಆಗ್ತಾ ಇರ್ಲಿಲ್ಲ. ಡಯಾಲಿಸಿಸ್ ಆದ್ಮೇಲೆ ಸುಸ್ತಾಗ್ತಾ ಇಲ್ಲ. 1 ವರ್ಷದಿಂದ ನಾವು ತುಂಬಾ ಕಷ್ಟಪಟ್ವಿ, ಬೇರೆ ಕಡೆ ಎಲ್ಲ ನೋಡಿದ್ವಿ, ಎಲ್ಲ ಕಡೆ ಯಾವ ಕಡೆನೂ ಸಿಗ್ಲಿಲ್ಲ. ನಮ್ಗೆ ತುಂಬಾ ಕಷ್ಟ ಆಗ್ತಾ ಇತ್ತು. ಮತ್ತೆ ಎಲ್ಲ ಕಡೆ ನಾವು ಕೆಳಬರಿಗೆ ಹೋದ್ರೆ 3 ವರ್ಷ 4 ವರ್ಷ ಇಲ್ಲ 5 ವರ್ಷನೇ ಆಗ್ಬೋದು ಅಂತ ಹೇಳ್ತಾ ಇದ್ರು. ಈಗ ಲಾಸ್ಟ್ ಅಲ್ಲಿ ಡಿಸಿಷನ್, ನಮ್ ಫ್ಯಾಮಿಲಿ ಡಿಸಿಷನ್ ತಗೊಂಡು ನಮ್ ತಂದೆನೇ ಕೊಡಕ್ಕೆ ಮುಂದೆ ಬಂದ್ರು. ಆಮೇಲೆ ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡಿದ್ವಿ. ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡಿದಾದ್ಮೇಲೆ ನಮ್ ತಂದೆ ಕಿಡ್ನಿ ಮ್ಯಾಚ್ ಆಯ್ತು. ಆಮೇಲೆ ಅವ್ರಿಗೆ ನಮ್ಮ ಕೃತಿಕಾ ಮೇಡಮ್ ಮತ್ತೆ ಅಶ್ವಿನ್ ಸರ್ ಅವ್ರ ಟೀಮ್ ಇಂದ ನಾವು ಮಾತಾಡಿ ಎಲ್ಲ ಅವ್ರು ನಮ್ಗೆ ಸಪೋರ್ಟ್ ಮಾಡಿದ್ರು. ಮತ್ತೆ ಹಾಸ್ಪಿಟಲ್ ಕಡೆಯಿಂದ ಸಪೋರ್ಟ್ ಮಾಡಿದ್ರು, ಫ್ಯಾಮಿಲಿ ಎಲ್ಲ ಸಪೋರ್ಟ್ ಮಾಡಿದ್ರು. ಆಮೇಲೆ ಒಂದ್ ಡೇಟ್ ಫಿಕ್ಸ್ ಮಾಡ್ಬಿಟ್ಟು ಆಮೇಲೆ ಕಿಡ್ನಿ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಎಲ್ಲ ಮಾಡಿದ್ರು. 100% ರಿಸಲ್ಟ್ ಕೊಟ್ಟಿದ್ದಾರೆ. ನನ್ನ ತಮ್ಮನೂ ಚೆನ್ನಾಗಿದೆ. ಧನ್ಯವಾದ ಹೇಳ್ತೇನೆ.
ಆವಾಗ ನಮ್ಗೆ ಉಳಿಸ್ಕೊಳ್ಸ್ಕೊಂತ ಇದ್ದೆ, ನಿಂಗೆ ಯಾವುದ್ರ ಬಗ್ಗೆ ಯೋಚನೆ ಮಾಡಬೇಡ, ನಾನು ಗಂಟ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ನಾನು ಅವಾಗ ಹೇಳಿದ್ದೆ ಕಿಡ್ನಿ ಕೊಡ್ತೀನಿ, ಬೇಕಾದರೆ ಎಲ್ಲ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡೋಣ, ಮಾಡಿದಾಗಿಲ್ಲ ಅಂದರೆ ನಾನು ಕೊಟ್ಟು ಇದು ಮಾಡ್ಕೊಳ್ತೀನಿ ಅಂತ ಹೇಳಿದ್ದೆ. ಅದ್ರ ಬಗ್ಗೆ ಡಾಕ್ಟ್ರ್ ಬಗ್ಗೆ ಒಳ್ಳೆ ಡಾಕ್ಟ್ರು, ಇಲ್ಲಿ ಒಳ್ಳೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಯಿತು, ಒಳ್ಳೆ ಸೌಲಭ್ಯ ಮಾಡಿದರು, ಒಳ್ಳೆ ಥರ ನೋಡಿದ್ರು ಬಿಡಿ. ಅದ್ರ ಬಗ್ಗೆ ಹೇಳಂಗಿಲ್ಲ, ಅಷ್ಟು ಕ್ಲೀನಾಗಿ ನೋಡ್ಕೊಂಡ್ರು ನಮ್ಗೆ. 2 ವರ್ಷದಿಂದ ಪ್ರಯತ್ನ ಮಾಡಿದೆ. ನಮ್ಮ ರಿಲೇಷನಲ್ಲಿ ಕೇಳಿದರೆ ಯಾರು ಮುಂದುವರಿಸಿಲ್ಲ. ಅದರಿಂದ ನಾನು ಡಾಕ್ಟ್ರ್ ಅವ್ರು ಹೇಳಿದ್ರು, ಒಂದು ಕಿಡ್ನಿ ಒಂದು ಕೊಟ್ಟಿದ್ರೆ ಏನೂ ಆರೋಗ್ಯಕ್ಕೆ ಏನೂ ಆಗೋಲ್ಲ, ಅವ್ರ ಆರೋಗ್ಯ ಆರಾಮಾಗಿರುತ್ತೆ ಅಂತ. ಅದರಿಂದ ನಾನು ಇದು ಮಾಡಿ ಡಿಸಿಷನ್ ಮಾಡಿ ನಾನು ನಮ್ಮ ಮಗನಿಗೆ ಕೊಟ್ಟಿದ್ದೆ.
ಅಲ್ಲ, ಈ ಕಿಡ್ನಿಗಿಂತ ಮಗ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂತೇಳಿ ಅನ್ನಿಸ್ತಾ ನಿಮ್ಗೆ? ಯಾವ ಮೂಮೆಂಟಲ್ಲಿ ಅನ್ನಿಸ್ತು ನಿಮಗೆ?
ಕಿಡ್ನಿ ಅಂದರೆ ಮಗ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂದರೆ ಲಾಸ್ಟ್ ಮಗ ಅವನು ಪ್ರೀತಿ ಜಾಸ್ತಿ, ಅದರಿಂದ ಕಿಡ್ನಿ ಕೊಟ್ಟು ಉಳಿಸೋಣ ಅಂತ ಪ್ರಯತ್ನ ಮಾಡಿ ಇದು ಮಾಡಿದೆ. ಒಳ್ಳೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟರು, ಒಳ್ಳೆ ನಮ್ಮ ಡಾಕ್ಟ್ರು ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಮನೆಗಿಂತ ಜಾಸ್ತಿ ನೋಡಿದ್ರು.
ಮಗನಿಗೆ ಕಿಡ್ನಿ ನೋವಾಗಿ
I am Dr. Ashwin, urologist and transplant surgeon working in Cytecare Hospital here. So, ಈಗ ನಾವು why we has joined here is ನಾವೊಂದು ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ಮಾಡಿದ್ವಿ ಮೊಟ್ಟ ಮೊದಲ ಬಾರಿಗೆ ಈ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ, ದಟ್ ಈಸ್ ಕಿಡ್ನಿ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಸರ್ಜರಿ. ಅದೊಂದು ಸಕ್ಸಸ್ ಆಗಿದೆ. ಆ ಒಂದು ಆನಂದವನ್ನು ನಿಮ್ಮಲ್ಲಿ ಹಂಚಿಕೊಳ್ಳಲು ವಿ ಹ್ಯಾಡ್ ಕಾಲ್ ದಿಸ್. ಸೊ ಐ ಥಿಂಕ್ ಇದೊಂದು ಹೇಳಲಿಕ್ಕೆ ಐ ಆಮ್ ವೆರಿ ಪ್ರೌಡ್ ಆಫ್ ಇಟ್. ನಾನು ತುಂಬಾ ಹೆಮ್ಮೆ ಪಡ್ತೇನೆ. ಎನಿ ಹಾಸ್ಪಿಟಲ್ ಯಾಕೆ ಒಂದು ಕಿಡ್ನಿ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ, ಇಟ್ ಈಸ್ ನಾಟ್ ಓನ್ಲಿ ಫಾರ್ ದ earning money. Actually, transplant is one of the most satisfying surgery as a surgeon, as a hospital. Yakandre, we are giving a new life to one person. So that was the main intention why our hospital was always planning for this. It's been 5, 6, 7 years now since the hospital started. We started, I think they already told about dialysis we started. But the aim was to start this transplant surgery, not only to earn whatever the profit, but it is always looking into the patient perspective. ಯಾಕಂದ್ರೆ ಇದರಿಂದ ಒಂದು ಹೊಸ ಜೀವನ ಬರ್ತದೆ, ಇದರಿಂದಾಗಿ ಅವರೊಂದು ನಾರ್ಮಲ್ ಆಗಿ ನಿಯರ್ ನಾರ್ಮಲ್ ಲೈಫ್ ದೇ ವಿಲ್ ಬಿ ಲಿವಿಂಗ್ ವಿತ್. ಸೊ ವಿ ಸ್ಟಾರ್ಟೆಡ್ ವಿತ್, ವಿ ಹ್ಯಾಡ್ ಲಾಟ್ ಆಫ್ ಚಾಲೆಂಜಸ್ ಫ್ರಮ್ ದ ಸ್ಕ್ರಾಚ್. ಅಂದ್ರೆ we had to get the team ready, there be licenses required, instruments ಬೇಕು, ಅದಕ್ಕೆಲ್ಲ important instruments. But we had an excellent support from the management, from the entire team, nursing team, the management team, multiple people involved in this. the multiple meetings happened. So that's how we came and finally one day we pointed, okay, this day we are going ahead with this transplant surgery. So Adina Bantu, we spoke to the patient. One more thing is there that we should always have good patients with us. So good patients will make our work much easier. I'm very happy that what we had, our patients are they're very nice to us. So they have confidence on us. When they have confidence on doctors, the immediate treatment is 100% success. So we went ahead with this is like one of the most complicated surgery. I can do a normal patient and now we bring him as a donor. And he's not a patient, that is a normal person. So the responsibility on the doctors are multiple. It's not once, because patient has okay, patient, but he's not a patient, he's a normal person. And giving a kidney, giving one part of the organ, like somebody asked, is one of the most, proud moment for him and such a big sacrifice from his side, actually. So we have taken care of him much more than anybody other person. So we took that responsibility, everything went well. Simultaneously, we operate both patients so that we decrease the time of forming what ischemia time and surgery ಮಾಡುತ್ತಾರೆ. So ಎಲ್ಲ ಚೆನ್ನಾಗಾಯಿತು. Post-op care also they went well with the post-operative period. Successfully, the urine started coming. That is the first thing what we look into actually. And so we are very happy with this whatever happened. So complicated thing by a teamwork, by a visionary management, that is what made this program a success. And we are looking forward to many more such things because we want to create that life in the patients and we want to create the awareness among them. And such kind of donation is much more than anything. One more thing what we can do is probably what we can bring to the people is something called donation from the cadavers or deceased donor. Because after death, still the things and body of organs can still be used for living the life of somebody else. So even news, even Mathew now ಮನೆಗೆ ತಿಳಿಸಿದ್ರೆ, so that will be a very helpful for the patients who are so many patients they don't have a donors. ಅವ್ರ ಕಿಡ್ನಿ ಇರಲ್ಲ, ಡಯಾಲಿಸ್ ಮಾಡ್ತಾ ಇರ್ತಾರೆ. ಸೊ even news ನಾವು ಮನೆಗೆ ಮುಟ್ಟಿಸಿದ್ರೆ, so probably patient ತುಂಬಾ ಹೆಲ್ಪ್ ಆಗ್ತದೆ. ಇನ್ ಮುಂದೆ these things can progress and India can progress. Thank you. Transplant, basically, the post-transplant, what happens is that there can be different kind of reaction to the patient. One, immediate response, immediate success. So with our patient, it was immediate success, so he never required dialysis. But there are chances that something called delayed function. And after 5 days, after 10 days, 15 days, 1 month, the function comes back. In those people, to bridge that gap, probably there are more chance of dialysis required. But less chances actually. So our patient was good, so everything went well. He never required dialysis. I think we sent him with a creatinine of 1, now it's 0.9. So it's a very good value for any normal patient.
Looking at the donor, So when you look at the test, we are talking about two people here. One is a patient the person who's donating the kidney, and the other one is a person who's receiving the kidney. We call them as recipient. So for us, donor is always more important than the recipient, in the sense that donor kidney ತಗೊಂಡ್ಮೇಲೆ ಅವ್ರ ಫ್ಯೂಚರ್ ಅಲ್ಲಿ ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಆಗಬಾರ್ದು. So we do all tests to find out whether he or she is at risk for kidney problem in the future. So most important, ಅವ್ರಿಗೆ ಕಿಡ್ನಿ ಇವಾಗ ಏನ್ ಕೆಲಸ ಮಾಡ್ತಿದೆ, ಯೂರಿನ್ ಅಲ್ಲಿ ಏನಾದ್ರೂ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯಾ, ಸ್ಕ್ಯಾನಿಂಗ್ ಅಲ್ಲಿ ಏನಾದ್ರೂ ಇದೆಯಾ, ಫ್ಯೂಚರ್ ಅಲ್ಲಿ ಶುಗರು BP ಬರಕ್ ಚಾನ್ಸಸ್ ಏನಾದ್ರೂ ಇದೆಯಾ, ಬಂದ್ರೇನು ಒಂದೇ ಕಿಡ್ನಿ ಇದ್ದಾಗ ರಿಸ್ಕ್ ಏನು, ಇವೆಲ್ಲ ನೋಡ್ತೀವಿ. So there are a lot of blood tests, scannings, and we also do some special scannings to see which kidney is working how much, ಯಾವ ಕಿಡ್ನಿ ತಗೋಬೇಕು. So we look at all of this for the donor. Recipient ಗೆ we look at again normally complete blood test, so urine test, so infection ಬರೋ ಚಾನ್ಸಸ್ ಎಷ್ಟಿರುತ್ತೆ ಕಿಡ್ನಿ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆದ್ಮೇಲೆ. ಮತ್ತೆ ಮ್ಯಾಚಿಂಗ್ ಡೋನರ್ ಕಿಡ್ನಿಗೂ ರೆಸಿಪಿಯಂಟ್ ಕಿಡ್ನಿಗೂ, ಡೋನರ್ ಕಿಡ್ನಿ ತಗೊಂಡ್ರೆ ಮ್ಯಾಚ್ ಆಗತ್ತಾ, ರಿಜೆಕ್ಷನ್ ಚಾನ್ಸಸ್ ಎಷ್ಟು, ಆ ರೀತಿ ನಾವು ವಿ ವಿಲ್ ಟೇಲರ್ ಇಮ್ಯುನೋಸಪ್ರೆಷನ್ ಟ್ಯಾಬ್ಲೆಟ್ಸ್. ಸೊ ಇವೆಲ್ಲ ಟೆಸ್ಟ್ ಮ್ಯಾಂಡೇಟರಿ ಮಾಡ್ತೀವಿ ನಾವು. And we sometimes even repeat this matching 2 times. Once when we start the workup, ಇನ್ನೊಂದು just before surgery. So ಇವೆಲ್ಲ ಟೆಸ್ಟ್ ಮ್ಯಾಂಡೇಟರಿ ಮಾಡ್ತೀವಿ ನಾವು.
ಡೊನೇಟ್ ಮಾಡಬೇಕಾದ್ರೆ ಏಜ್ ಲಿಮಿಟ್ ಏನಿದೆ?
ಸೊ ಏಜ್ ಲಿಮಿಟ್ ಆ ಥರ ಏನು ಇರಲ್ಲ, ಬಟ್ ಜನರಲಿ ಇವಾಗ ರೆಸಿಪಿಯಂಟ್ ಅಂದ್ರೆ ಯಾರು ಕೊಡ್ತೀವೋ we generally try to match the age. Ivaga, if we take usually 30 or 40-year-old, we want the kidney also to be maybe 30, 40 or maybe 50, maybe 10 years older. Ivaga 20-year-old ಗೆ 70-year-old kidney ಆದರೆ ಅದು ಕೆಲಸ ಮಾಡೋದು because each kidney will also age. So usually we try to match, but if there is no match, we take anything that is available. ಆ ಥರ restrictions ಏನು ಇರಲ್ಲ. So I think the oldest kidney we have taken is about 70, 72 years donate ಮಾಡಿದ್ದಾರೆ ಅವ್ರ ಮಗನಿಗೆ 50-year-old. So there is no restriction as long as the kidney function is okay and they don't have any problems. ಆ ಥರ restrictions ಇರಲ್ಲ.
Any follow-ups after surgery?
Yes. So for the transplant donor, usually 3rd to 4th day we discharge the donor, and after that we see him after 3 days and then maybe after 1 week. And depending on how he is doing, every 6 months or yearly once ಅವ್ರಿಗೆ ಕಿಡ್ನಿ ಟೆಸ್ಟ್ ಮಾಡ್ತೀವಿ. ಫ್ಯೂಚರಲ್ಲಿ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಬರ್ಬೋದಾ, ಅದ್ರ ಜೊತೆಗೆ ಬಿ ಪಿ ಏನಾದರೂ ಶುರು ಆಗಿದೆಯಾ, ಶುಗರ್ ಏನಾದರೂ ಬಂದಿದೆಯಾ. ಈವನ್ ಇಫ್ ದೇ ಹ್ಯಾವ್ ಡಯಾಬಿಟೀಸ್ ಆ್ಯಂಡ್ ಹೈಪರ್ ಟೆನ್ಷನ್ ಆಫ್ಟರ್ ಡೊನೇಷನ್ ನಾವು ಕಂಟ್ರೋಲ್ ಮಾಡಿದ್ರೆ ಉಳಿದಿರೋ ಕಿಡ್ನಿಗೆ ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಆಗಲ್ಲ. ಸೊ ಸೆಕೆಂಡ್ ಥಿಂಗ್ ಇಸ್ ರೆಸಿಪಿಯೆಂಟ್ಗೆ. ಸೊ ರೆಸಿಪಿಯೆಂಟ್ಗೆ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆದಮೇಲೆ ಫಸ್ಟ್ 1 month ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಆಕ್ಚುಲಿ ಐ ವುಡ್ ಸೇ ಫಸ್ಟ್ 3 months are very important. This is where the infection risk is quite high and rejection risk is also quite high. So we see them at least 2 times a week to adjust the medicines. ನಾವು ಮೆಡಿಸಿನ್ಸ್ ಜಾಸ್ತಿ ಕೊಟ್ಟರೆ ಇನ್ಫೆಕ್ಷನ್ ರಿಸ್ಕ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಕಡಿಮೆ ಕೊಟ್ಟರೆ ರಿಜೆಕ್ಷನ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಸೊ ವಿ ನೀಡ್ ಟು ಮೇಂಟೈನ್ ಅ ಬ್ಯಾಲೆನ್ಸ್. ಸೊ ಫಸ್ಟ್ 1 monthಗೆ ವೀಕ್ಲಿ 2 times, ಅದಾದ್ಮೇಲೆ 15 ದಿವಸಕ್ಕೆ ಒಂದ್ಸತಿ, 3 to 6 months ಆದ್ಮೇಲೆ once in 3 months ಅಥವಾ once in 6 months depending on how the patient is doing. That's how we do.
Just ours, it's many people's. So first of all, I would like to thank the donor for coming forward and donating the kidney to his son. Secondly, the support of the hospital, starting from Mr. Jojis and the management team. But most importantly, anaesthesia, Dr. Dinesh and his team, nursing team, supportive staff. So I think everybody has played a role in the success for this first transplant to go smoothly. And I don't think it would be, I should leave out thanking them before we end this session.